In the world of diabetes treatment, a promising new drug called Tirzepatide is revolutionizing the way we approach the management of this chronic condition. With its unique mechanism of action, Tirzepatide is shaping the future of diabetes treatment like never before. Tirzepatide works by targeting multiple receptors in the body, leading to improved glycemic control and weight management for patients with type 2 diabetes. Unlike traditional medications that focus solely on insulin regulation, Tirzepatide goes beyond that, addressing other physiological factors contributing to diabetes. By activating both the glucagon-like peptide 1, GLP-1, and the glucose-dependent insulinotropic polypeptide, GIP, receptors, Tirzepatide enhances insulin secretion, suppresses glucagon release, and promotes satiety. These actions not only help lower blood sugar levels but also aid in weight loss. With its potential to offer better glycemic control, weight management, and cardiovascular benefits, Tirzepatide is gaining attention as a game-changer in the field of diabetes treatment. As research continues and clinical trials progress, Tirzepatide is positioning itself as a potential breakthrough therapy that could significantly improve the lives of those living with diabetes. How Tirzepatide works in the body. By activating both the glucagon-like peptide 1, GLP-1, and the glucose-dependent insulinotropic polypeptide, GIP, receptors, Tirzepatide enhances insulin secretion, suppresses glucagon release, and promotes satiety. These actions not only help lower blood sugar levels but also aid in weight loss. Tirzepatide's activation of GLP-1 receptors stimulates insulin release from pancreatic beta cells. This increased insulin secretion helps to optimize blood sugar control, allowing patients to better manage their diabetes. Additionally, the activation of GIP receptors by Tirzepatide leads to further enhancement of insulin secretion. Benefits of Tirzepatide treatment. The unique mechanism of action of Tirzepatide offers several benefits for individuals with type 2 diabetes. Firstly, it helps to improve glycemic control by lowering blood sugar levels. This can lead to a reduction in HbA1c levels, a long-term measure of blood glucose control. By targeting multiple receptors involved in glucose regulation, Tirzepatide provides a more comprehensive approach to managing diabetes than traditional medications. In addition to improving glycemic control, Tirzepatide also offers benefits in terms of weight management. The drug's activation of GLP-1 receptors promotes satiety, making patients feel fuller for longer. This can help to reduce calorie intake and lead to weight loss. For individuals with type 2 diabetes who are overweight or obese, this dual benefit of Tirzepatide makes it an attractive treatment option. Furthermore, Tirzepatide has shown potential cardiovascular benefits in clinical trials. In a study called SURPASS-2, Tirzepatide demonstrated a significant reduction in major adverse cardiovascular events compared to placebo. This suggests that Tirzepatide not only helps to manage blood sugar levels but also has a positive impact on heart health, which is particularly important for individuals with diabetes who are at a higher risk of cardiovascular complications. Clinical trials and research findings. Clinical trials have shown promising results for Tirzepatide in the management of type 2 diabetes. In a phase 3 trial called SURPASS-2, Tirzepatide demonstrated superior glycemic control compared to both placebo and another commonly used diabetes medication, insulin glargine. The study included over 1,500 participants with type 2 diabetes and showed that Tirzepatide significantly reduced HbA1c levels and body weight compared to the control groups. Another phase 3 trial, SURPASS-5, evaluated the cardiovascular safety of Tirzepatide in over 3,000 participants with type 2 diabetes. The study found that Tirzepatide met the primary endpoint of non-inferiority for major adverse cardiovascular events compared to placebo. This suggests that Tirzepatide is not only effective in managing blood sugar levels but also safe in terms of cardiovascular outcomes. Comparing Tirzepatide to other diabetes medications. Tirzepatide stands out from traditional diabetes medications due to its unique mechanism of action. While medications like metformin and sulfonylureas primarily focus on insulin regulation, Tirzepatide addresses multiple aspects of diabetes physiology. By targeting both GLP-1 and GIP receptors, Tirzepatide offers a more comprehensive approach to glycemic control and weight management. In comparison to other GLP-1 receptor agonists, Tirzepatide has shown superior glycemic control and weight loss effects. In clinical trials, Tirzepatide consistently demonstrated greater reductions in HbA1c levels and body weight compared to other GLP-1 agonists such as liraglutide and dulaglutide. This suggests that tirzepatide may be a more effective treatment option for individuals with type 2 diabetes who struggle with glycemic control and weight management. Potential side effects and safety considerations. As with any medication, tirzepatide does have potential side effects and safety considerations. Common side effects reported in clinical trials include gastrointestinal symptoms such as nausea, vomiting, and diarrhea. However, these side effects were generally mild to moderate in severity and improved over time. It is important for healthcare providers to monitor patients closely during the initial stages of tirzepatide treatment to manage any potential side effects. Another safety consideration with tirzepatide is the potential risk of hypoglycemia, particularly when used in combination with other diabetes medications such as insulin or sulfonylureas. Close monitoring of blood sugar levels and appropriate dosage adjustments are necessary to minimize the risk of hypoglycemia. Future implications of tirzepatide in diabetes treatment. Tirzepatide's unique mechanism of action and promising clinical trial results position it as a potential breakthrough therapy in the field of diabetes treatment. As research continues and more data becomes available, tirzepatide may offer new avenues for managing diabetes and improving patient outcomes. The potential cardiovascular benefits of tirzepatide are particularly noteworthy. Cardiovascular disease is a major concern for individuals with diabetes, and if tirzepatide can provide both glycemic control and cardiovascular protection, it could have a significant impact on reducing the risk of cardiovascular complications in this population. Availability and accessibility of tirzepatide. Currently, tirzepatide is still in the investigational stage and has not yet been approved by regulatory authorities. However, based on the positive results from clinical trials, it is anticipated that tirzepatide will soon be available as a treatment option for individuals with type 2 diabetes. The accessibility of tirzepatide will depend on factors such as cost and insurance coverage. As with many new medications, there may be initial challenges in terms of affordability and availability. However, as tirzepatide gains approval and enters the market, it is hoped that it will become more widely accessible to those who can benefit from its unique mechanism of action. Conclusion: the promising role of tirzepatide in shaping the future of diabetes treatment. Tirzepatide's unique mechanism of action, targeting multiple receptors in the body, distinguishes it from traditional diabetes medications and positions it as a potential breakthrough in the management of type 2 diabetes. Its multifaceted approach involves enhancing insulin secretion, suppressing glucagon release, and promoting satiety, collectively contributing to improved glycemic control and weight management for individuals grappling with this metabolic condition. Clinical trials have unveiled not only tirzepatide's efficacy in reducing blood sugar levels but also its ability to provide significant cardiovascular benefits. This dual action sets it apart, as cardiovascular health is a critical consideration in the comprehensive management of diabetes. The potential to address both glycemic control and cardiovascular protection positions tirzepatide as a noteworthy contender in the evolving landscape of diabetes treatment. While tirzepatide is currently in the investigational stage, the data generated from clinical trials underscore its promising impact on diabetes care. As research continues and the drug progresses through regulatory approval processes, tirzepatide holds the potential to revolutionize the approach to managing diabetes and enhancing patient outcomes. The prospect of a medication that not only addresses blood sugar levels and weight but also offers cardiovascular benefits is particularly encouraging for individuals with type 2 diabetes, who often face a multitude of health challenges. Looking ahead, as tirzepatide advances toward wider availability, it could play a pivotal role in shaping the future of diabetes treatment. The integration of this novel therapy into clinical practice may usher in a new era characterized by improved glycemic control, effective weight management, and enhanced cardiovascular protection for individuals grappling with type 2 diabetes. As healthcare professionals and patients alike eagerly anticipate further developments, tirzepatide stands as a beacon of hope in the ongoing quest for more effective and holistic diabetes management strategies. Thanks for watching.